I think we're live.
Great. And I just sent everyone an email. I'm really sorry about the technical delay. This is our founder, Kobe.
Hi, everyone.
He's also the tech guy, and he's making sure that our stream is set up so that there won't be any further delays. I know that I promised our event would be over in only an hour, so I'm still going to try to keep it to 45 minutes. It'll give us a little less time on questions, but I'll try to address your questions along the way. Great. So first, I want to introduce myself. Let me just make sure the slide deck is full screen so you guys can read it easily. There we go. Nice. So come on in, everyone. Come on in. I know some of you probably just got the email that we were experiencing technical difficulties. It's okay. We'll make up time on the back end. I'm so grateful that you could join us for this very special presentation of Medicare Made Simple. And it's really nice to meet you. First, I want to introduce you to me. My name is Ari Parker. I'm Chapter's lead Medicare advisor. And I know that I look like I just got my driver's license, but I'm actually in my mid-30s, and I really love giving these presentations, and it's part of our mission at Chapter. We try to educate people around Medicare and about making better Medicare choices, and we've actually helped thousands of seniors free of charge learn more about their Medicare options and reconfirm their coverage. So it's not just for people who are turning 65. This presentation is really for anyone who's near or already has Medicare, or maybe you're helping a loved one sign up for Medicare. And what our mission is for today is to make sure that you're empowered with the knowledge you need to sign up for Medicare, that you understand the complexity of the process, and the reason why many people use an advisor, Chapter is one of them, is because of just how difficult the process is to navigate. But that doesn't mean that it has to be confusing. And that's really one of the keys about working with an advisor. And Chapter is one of the advisors. There are other advisors too. But if you want to get in touch with us, you have my email. It's ari@getchapter. You're also welcome to call 605-205-8869. So feel free to ask questions along the way. There'll just be time at the end to address your questions. So the agenda for this afternoon is that I'm going to introduce you to a fusion of two types of clients from your community. Right now, we're focused in Palm Beach, Florida, actually. And two people that we recently helped in Palm Beach were Ronald and Linda. I'm going to walk you through the three critical decision phases that Ronald and Linda went through and that we help clients like Ronald and Linda go through. And then finally, I'm going to address the 5 most common mistakes we've seen people make. I share them with you so that you can help you and your loved ones avoid them in the future. So meet Ronald and Linda. I know you're from all over the country, but if you're near Florida, then you've probably met people like Ronald and Linda. Ronald just turned 65 at the beginning of the month. He's retired, and Linda is a little bit older. She also has health coverage through her employer. Budget-wise, Ronald is mostly reliant on Social Security, whereas Linda has saved quite a bit. And finally, you'll note that Ronald mainly enjoys staying around Palm Beach, whereas Linda loves to travel. She wants to use her savings to travel as much and outside of Florida in the future as she can. Now, I want you to see the journey that my team and I took Ronald and Linda on to help guide you through what our thinking was and why Ronald and Linda made the choices that they did. So there were 3 decisions that we helped advise clients like Ronald and Linda on. The first is that we helped them sign up for traditional Medicare. Second, we advise them to consider additional coverage. That's because Medicare doesn't cover all of the costs or all of the care that you'll need in retirement. And third, once we helped Ronald and Linda decide on additional coverage, we then looked at specific plan options and helped them enroll so there'd be no gap in coverage once they started their retirement. But don't worry, I'm going to walk you through each of these stages so that you can understand them and feel confident about it and ask questions. Step one, how to sign up for traditional Medicare. There are two parts to traditional Medicare. Part A is hospital insurance. It's things like inpatient care in a hospital, care in a skilled nursing facility, and home health care. Then there's Part B, which is medical insurance. That typically covers doctor's visits. It also covers things like preventative services, going for a flu shot. Now, there's the question of, well, how do you pay for Part A and Part B? Part A is straightforward. It's usually already paid for. It's been deducted as a payroll tax during your working years. Part B is where it gets interesting, though. In Part B, many people don't know that you actually have to pay your premiums to the government to get your Part B coverage. If you're enrolled in Social Security, your Part B premium is actually deducted from your Social Security check. And if you haven't signed up for Social Security, let's say you've decided to wait until you're 70, then you'll get a bill from Medicare directly for your Part B premium. Now, how does this apply to Ronald and Linda? Well, it's pretty straightforward for both of them. They both should sign up for their Medicare Part A as soon as they're eligible. And that's what we typically advise clients like Ronald and Linda to do, with one exception. If you're contributing to a health savings account, you won't be able to make further contributions after you enroll in Medicare. So it can be advantageous then, if you want to keep making contributions, to delay the decision to start your Medicare. And the reason why generally we advise clients to enroll, however, is because it's already paid for. So there's no reason not to start getting the benefit of your Part A hospitalization services. So just a small aside on the health savings account, if it applies to you, reach out after, let's talk more about it, but typically it doesn't apply. And so then you should start your Part A as soon as possible. Now, what about their Part B? Well, the Part B decision is where they differ. Now, for Ronald, he retired at age 63. So he's been ready to start using his Medicare benefits. So we advise clients like Ronald to start their Medicare as soon as they're eligible, to opt into Part B. Then, what about clients like Linda? Well, we advise Linda to wait to enroll for Part B. And the reason is because she's already getting coverage through her employer health plan. So there's no reason for her to be paying two premiums, potentially one to her employer if she owes one, and then also for Medicare Part B, because she already has her group health coverage, and usually that's good enough. And we'll talk more about which types of employer health plans would qualify there. So I just want to dig in more on why we advise Linda to wait. Well, the reason is because Part B would require her to pay premiums to the government. And there's no reason for her to be paying that twice. And that's why we typically advise clients like Linda to wait. Instead, seniors like Linda will get a special enrollment period, and I'll get to that in a moment. So now that I've addressed when you should sign up for Part B, I want to go into detail about the deadlines. So let's take Ronald, for example. Ronald's birthday was October 2nd, so just last month. Well, Ronald actually could have started to sign up for Medicare in July, and that's actually when he reached out to us. He started the process in July. It means that his Medicare would still go into effect October 1st, but it's okay because he's allowed to tell Medicare, hey, I want to start, send me my Medicare card so I can begin paying my Part B, and it'll actually go into effect in the month in which his birthday takes place. It will go into effect in the month in which your 65th birthday takes place. What's the latest that you can sign up for Medicare? Well, the latest is actually 3 months after. So what's critical to remember here is that it's a 7-month enrollment period. It starts 3 months before the month of your 65th birthday, and it ends 3 months after your 65th birthday. Using the example of Ronald, the latest that he could have signed up actually would have been January 31st, because that would be 3 months after October. Now, what about the special enrollment period that I mentioned for someone like Linda, who's still coming off her group health coverage? Well, when Linda decides to retire from her large group health employer, or excuse me, from her plan, which is one that has over 20 employees, that'll open an 8-month window for Linda to sign up. And we definitely don't want you to wait until the tail end of that 8 months, because remember, you don't want there to be a gap in your coverage. You actually you'll only be covered if by traditional Medicare, if you wait to sign up for Medicare. You need to affirmatively opt into your Part B coverage in order for it to start. And excuse me there, because I explained that confusingly. I meant that you won't have any coverage if you don't decide to opt into your Part B. It's something you affirmatively need to reach out and tell the Social Security Administration that you intend to do. And while generally the window is 8 months, there might be situations in which you actually need to act sooner. For example, if you want to sign up for a Medicare Advantage plan, which we'll discuss later, or a Part D drug plan when you leave your group coverage, then you'll actually have a tighter window in order to act. It'll be less than 8 months. And situations like these covering special enrollment periods is where it can really be helpful to work with an advisor, because it is just so complex when it kicks in and it's not automatic. And that's why we encourage you to reach out to an independent advisor, of which we are one. And so now I want to cover why clients like Ronald and Linda decide to get additional coverage. I think this is one of the most important things I'm going to cover with you this afternoon. The reason people decide to get additional coverage is because traditional Medicare leaves you responsible for paying at least 20% of your medical costs. Traditional Medicare only covers 80%. So that leaves you on the hook for 20% of your medical. But what people don't realize is that there are also other benefits, ancillary benefits, like prescription drugs and services like dental, vision, and hearing, that traditional Medicare doesn't touch at all. And when people realize that their drugs aren't covered, that their vision isn't covered, that their dentistry isn't covered, and that their hearing isn't covered, that's typically when they call us to try to find ways to get that supplemental coverage. And when that's why these category of costs at the bottom that you see, that's why it would be it's so powerful to work through your options and to figure out what type of additional coverage that you want. In fact, 60% of Americans and growing purchase some type of additional coverage. So if you're here and you're thinking about additional coverage, you're not alone. Many people are in that position as well, and that's why we're here. With that, let me go to step 2 of our journey, which is what to do about all the additional costs that traditional Medicare just doesn't touch. Now, this is the most tedious slide of the presentation, but the reason I put it here is I want to break down the differences between Medigap and Advantage plans for you. So Medigap sits on top of traditional Medicare. That's why it's called Medigap, because it covers the 20% that is not covered by traditional Medicare. And in contrast, Medicare Advantage is a substitute for traditional Medicare. Now, it has to cover exactly the same services, but it's administered through private insurance companies. And it often includes those additional benefits that I was talking about, like hearing, dental, and vision. So what type of coverage did Ronald choose? Well, Ronald's goal was to minimize his monthly premiums. So Ronald actually chose a Medicare Advantage plan. And here are some important things that you should know about Medicare Advantage plans. 4 things in particular. First, it's the most inexpensive type of additional Medicare coverage, and some plans offer $0 premiums. That's because the government is paying for it, not you. Second, many of these plans include some type of prescription drug coverage. In fact, if you don't go the Medicare Advantage route, you'll have to pay for a standalone Part D prescription drug plan if you want your prescriptions to be covered. Third, Medicare Advantage plans typically have a network of providers. That allows the carriers to offer lower premiums, but it constrains your choice because you can only see doctors that are in network. Otherwise, you're going to have to pay a larger share of the cost. And fourth, there are additional benefits for these plans: dental, hearing, vision. That's really why people love we find that some of our clients love Medicare Advantage plans. It's for these supplemental benefits. And the final thing I want to stress, and I'll repeat this again, is that you can't have both a Medicare Advantage plan and a Medigap plan. It's one or the other. And I have to tell this to clients all the time. You just can't have both. Now that I've addressed the type of coverage that Ronald chose, which was a Medicare Advantage plan, I want to discuss what type of coverage Linda selected. So Linda's situation was different. Unlike Ronald, she was less concerned about premiums. Instead, her priority was to see any doctor who accepts Medicare with no network restrictions. So what type of plan did Linda choose? Well, Linda selected a Medigap plan. And again, Linda's priorities were different from Ronald's, and that's why it really can be beneficial to talk through your priorities with an advisor. What should you know about a Medigap plan? 3 things in particular. The first is if you have a Medigap plan, you can see any doctor who accepts traditional Medicare, full stop. As long as your doctor accepts traditional Medicare and is accepting new patients, you can see that doctor and it will be covered by your Medigap plan. The second thing to know is that there are only certain points in time where you can sign up for a Medigap plan. It's called a guaranteed issue window, and I'll come back to that in a moment. Third, Medigap is a little more expensive than a Medicare Advantage plan. And that's because not only do you owe your Part B premium, just like you would under a Medicare Advantage plan to Uncle Sam, but you also owe a separate premium to your Medigap insurance carrier. And the premiums are typically more expensive than you would find on a Medicare Advantage plan. And then finally, I might sound like a broken record, but you can only have one or the other. You can't have both a Medigap plan and a Medicare Advantage plan. Okay, I just mentioned Linda's guaranteed issue window, and I know you might wonder, what's that? Well, a guaranteed issue window is a period of time where you are exempt from medical underwriting. In fact, a carrier must sell you a Medigap policy. It also means that they have to cover all your pre-existing conditions with no exclusions. And the best part is they can't charge you more to do it. So just because you've had past or maybe you have present health problems, you can't be charged a higher rate if you're operating within your guaranteed issue window. And I really want to stress this. This varies by state, but if you're in California, if you're listening to this presentation from California, first, it's still morning, so good morning if you just woke up. But also, I want to emphasize that you really only have the first 6 months after you start your Part B, where by law in California, you are operating under your guaranteed issue rights. And this varies by state. So if you're in a different state, let's say if you're in Florida or New York, give me a call because your guaranteed issue rights in New York, for example, are very different than in Florida. So you may have noticed I haven't mentioned anything as it pertains to Linda's prescriptions, whereas Ronald was able to acquire his prescriptions through his Medicare Advantage prescription drug plan. How does someone like Linda get drug coverage? Well, you already know that Medigap doesn't cover your prescriptions. So the answer is that Linda purchased a standalone Part D drug plan. And here's what I mean when I say a standalone Part D drug plan. The first is that it covers your prescription drugs. You probably already knew that. It's paid for partly by the government and partly by you through a premium if you purchase a standalone plan, or it's wrapped in if you if you purchase a Medicare Advantage plan that has prescription benefits, and most do. And the reason to get it is, let me explain why. It's technically optional, but the vast majority of the time we recommend that our clients get one. And the reason is the lifetime penalty. In fact, I was talking to a client yesterday who's in their 90s, very lovely, but didn't realize that the law had changed in 2006 and that you're now actually required to have prescription drug coverage. So they had gone over 14 years without Part D standalone coverage. They had a Medigap plan. So they actually owed a penalty of 174 months because for that period of time, they just hadn't had standalone Part D coverage. And so to get that coverage now, they would have to pay a massive penalty in order to get it. I really don't want you to end up in that position. So how do you get it? There are two ways. The first is that you could purchase it as a standalone plan. That's if you have a Medigap like Linda, for example, or it could come with your plan, for example, as it did with Ronald's, as part of a Medicare Advantage prescription drug plan. So I want to really go through the difference between Medigap and Medicare Advantage, just so we can get super clear on which type of coverage you should consider. Because we really try to walk through our clients when we meet them for the first time, both types, so then they can decide which factors are most important to them based on their values. So Medigap plans have higher premiums, but they lower your out-of-pocket costs in the forms of copays or deductibles. Medigap also allows you to see any doctor who accepts traditional Medicare. This is one of the biggest perks of the Medigap plan, of a Medigap plan. And we typically advise clients to purchase standalone Part D prescription coverage when they go the Medigap route. And finally, Medigap plans typically don't offer supplemental benefits as part of the plan. You can certainly pay for them, and we've helped many clients do that. But typically, as part of your premium, you're not getting supplemental benefits, unlike you would with a Medicare Advantage plan. By contrast, Medicare Advantage plans have lower premiums, but higher out-of-pocket costs. They typically have a predefined network through the carrier, and they usually come with prescription drug coverage. And finally, the best part, they have supplemental benefits, dental, hearing, vision, chiropractic, transportation services. There are a lot of perks to Medicare Advantage plans, and they vary by plan, so it's very plan specific. Now, after choosing between a Medigap or Advantage plan, many seniors stop their journey, and they don't go into the detail of choosing a specific plan. There is still one step remaining, which is you need to choose within which type, within which universe you're in, what type of plan you actually want to join. So the last stage of our Medicare journey is deciding which type of plan to choose. And I just want to say that this is where it really counts to work with an independent advisor who can search all plans and all plan types with you. Many advisors specialize in either the Medigap universe or the Medicare Advantage. You need an advisor who is comfortable working with both so that they can truly offer you your full suite of options. So I want to show you all the options that would be available to you if you lived in Miami-Dade County, for example. You would have over 357 Medigap plans to choose from and 59 Medicare Advantage, also known as Part C plans. That's a lot of choices to make. So even if you decide, all right, I want to go with a Medicare Advantage plan, you're not done. If you live in Miami, for example, you still have 59 plans to sort through at that point. So what do these plans differ on? Well, first, they all have different premiums. Each plan is priced differently, and they differ on specific factors as well, like their benefits, their deductibles and copays, the out-of-pocket maximums, and also the physician networks, which doctors you can see. And when clients find that it's so different based on the factors that they consider important and how they rank those factors, they come to us to help them work through which factors are important. And when we're meeting clients, these are typically the factors we see that they consider. The first is cost. Do they want to pay more upfront, or are they willing to pay less in premium in order to accept more risk of out-of-pocket costs on the back end? The second is the doctors they want to see. Many of them are coming in with long-standing relationships. You've built trust with your physician, and you want to make sure that you're purchasing a plan where you can continue to see that doctor. If it's very important for you, if you have a lot of doctors, then you're probably going to be looking at a Medigap plan to make sure that you can continue to see all those different doctors as long, of course, as they accept traditional Medicare. And then another factor to consider is the type of medications that you take, because the plans are going to differ, especially a Medicare Advantage prescription drug plan, for example, on what your costs are going to be associated out of pocket with your prescriptions. And then finally, it's very important to consider, maybe you haven't been outside in a while due to COVID, but when things wind down and when we start traveling again, it's very important to consider how much you want to travel outside of your home base. Because if you live in Florida, for example, but you're going to be spending a lot of time skiing in Colorado, then it would be really advantageous to consider a Medigap plan, because you're probably going to be out of network when you're in Colorado over the winter, and you want to make sure that you won't get hit with a huge out-of-pocket cost if you need to see a doctor. And I just want to emphasize that what I'm discussing, all of these plan types change every single year. In fact, we just published information on 2021 plans. As you know, right now is the annual enrollment period. And what we've noticed as compared to 2020 plans is that the premiums have changed, the benefits have changed, and the physicians, the doctors that you can see have changed too. And if you want, you could confirm your plan's network by going to each insurance carrier's website and entering your doctor's name. Or you could have someone like me or a team member help do that for you and avoid the frustrating process of navigating your insurance carrier's website. We do this for clients every single day, and it's very exciting actually for us to go and find that a doctor is covered by one network, but not a different one. And we love doing this for clients. It's really something that we want to do every single year. Because these networks change, and a doctor that you may have thought was covered or had been covered in the past is not covered anymore. And then finally, you don't have to make these decisions on your own. There are many advisors who are available to help you with this if it's not something you feel comfortable navigating on your own. But I think that if you look at our website, getchapter.com, and you enter and you use the tool that we've created, you'll see that we have built a platform that really makes it easy for you to enter your doctors, your prescriptions, and to reconfirm your coverage. And then you get to, once you have a short list of options, you get to connect with someone like me or a team member and discuss which plan is right for you. So now I want to cover the top 5 Medicare misconceptions that we see. These are mistakes that, for example, I mentioned one earlier about waiting to enroll for Part D standalone drug coverage, and we want to make sure that we help you avoid them too. There's no pressure to write this down. I will recap them at the end, and I will also send these slides to you as a thank you for coming to the presentation. So the first misconception that we see is that traditional Medicare covers all medical costs. You know it doesn't cover all your costs. It only covers 80%. And excuse me, I was a little too fast there. When clients realize that they still are responsible for the 20% out of pocket, that's when they consider a Medigap, which is how to cover the gap, or a Medicare Advantage plan, which is also how to cover that 20%, but administered through private insurers and typically comes with supplemental benefits. All right, the second misconception is that it's automatic when you turn 65. You need to affirmatively opt in to your Part B coverage. As you saw with Linda, her coverage wasn't automatic. She was still working. So when Linda was ready to retire over the summer, we actually helped Linda inform the Social Security Administration that she wanted to start her Part B coverage. And we're happy to help you do that too. If you would like a link as to how to start your Part B coverage, I can send you information, and definitely reach out to me at ari@getchapter.com following the presentation. The third misconception is that it doesn't matter when you sign up for Medicare. Now, at this point, you know that there are penalties. There are two in particular. The first penalty is on Part B. So you'll pay a 10% penalty on top of your Part B premium for every full year that you wait to sign up. There's also a Part D penalty, which I mentioned earlier. The Part D penalty is 1% of the average Part D premium for every month you wait after the end of your initial enrollment window. And this table is an example of just how punitive these penalties can get. And the worst part is that there are lifetime penalties. So if you're in the penalty window now, I would definitely advise you to start exploring how to stop the clock on your penalties, because they will continue to accumulate the longer you wait, and you'll owe them for the rest of your life. The fourth misconception is that your neighbor's Medicare coverage is also a good plan for you. Well, as you know from earlier, there are several factors to consider when choosing a plan. And if the way that you weight these factors is different than the way your neighbor did, then their plan might not be such a good idea for you. Again, your cost sensitivity might differ from your neighbors. The doctors that you like to see, you probably don't see the same doctors as your neighbor. Your prescriptions aren't the same. And also you have different lifestyle preferences, different travel preferences, and different ways in which you want your Medigap or your Medicare Advantage plan to work for you. And all of those are important for you to consider when making a choice. And that's why it can really be helpful to work with an advisor here in order to sort through these factors. And maybe your neighbor wasn't as thoughtful when going through these options as you have been by coming to this presentation. And if that's the case, then I would be happy to speak with your neighbor and walk through how their Medicare coverage has been working for them and assess whether it's still the right plan for them in 2021. The final misconception is that you only need to choose additional Medicare coverage once. Not true. You know that in fact, you should choose or reconfirm your coverage every single year. It's very important because the premiums change, the benefits change, and the doctor's network change. And that's why right now, during this annual enrollment period, you have maximum flexibility to change your plans. And we're seeing a lot of people look at their plans and ask to make sure that the plan that they were on in 2020 is the right plan for them beginning in January. And that's where it can really help to work with an advisor. And again, we are one of them. I would love to speak to you. A team member would love to speak to you. You could also go to our website, getchapter.com, and reconfirm your coverage right from the comfort of your computer. So to recap the misconceptions, traditional Medicare doesn't cover all your medical costs. It only covers 80%. It's not automatic when you turn 65. It really matters when you sign up for Medicare. We really don't like our clients coming to us late and then owing a lifetime penalty to Medicare. We don't know if your neighbor's Medicare coverage is a good plan for you. It really depends on your specific factors. And then finally, you should reconfirm your Medicare coverage every single year. So I just wanted to wrap up and thank you for attending. I know a lot of you probably have questions. I'm really excited to answer any questions you've left for me in the comments. And with that, I'll leave my information up if you'd like to contact me, and I'm open for questions. So I'm just going to talk about, while I'm waiting for the first questions to roll in, a little bit of context on what we see, what we've been noticing through 2021. What we've been seeing on plans that are being offered for next year is that premiums have actually been going down a little bit as compared to the last 3 years. It doesn't mean, of course, that every plan has gone down, but we are seeing that premiums have decreased slightly generally. We're also seeing that networks have really changed. And so if you're, for example, part of a network that you thought, and you need to see a specialist, and you thought, oh, well, that specialist, when I checked last year, but I didn't make an appointment, and now that appointment's been pushed to January, that doctor might not be covered in January because the networks are going to change over. And in fact, this can be a point of confusion for clients. The networks are actually changing over the course of the year too. So it's not just January 1st. It's actually during the course of the year that a network can change, unfortunately. And that's where it can really help. Someone will call me and they'll say, Ari, I wanted to see this specialist in Lufkin, Texas, for example. This really happened on Monday. And I'll look up, I'll look on a carrier's website and I'll see that the specialist is no longer covered in that network. And so now either the member needs to work with a different specialist who is covered, or they would need to be comfortable bearing the out-of-pocket costs of seeing that specialist with the understanding that the specialist is actually out of network. So just waiting for a few more questions to come in. Keep posting them in the comments. I also wanted to talk a little bit about some Medigap questions that I've been seeing recently. I've been seeing a lot of discussion on Plan G, standard Plan G, which is plan letter G, as compared to, for example, some high deductible plan letter Gs. This is really an individual choice here of how much you would want to bear out of pocket. If you go with standard plan letter G, then you'll actually only owe $198 annually for your Part B premium. But if you go with the high deductible plan G, you will owe $2,340 out of pocket. So that's really a significant difference. So that can explain just why you see such a big monthly premium jump to get a standard plan G as opposed to a high deductible plan G. But we don't like seeing our clients realizing that, yes, they got the premium savings, but now on the back end, they owe almost $2,400 potentially. So a question from Jan, why is Chapter different from other Medicare advisors? Well, great question, Jan. Thank you for asking. The reason is because we're independent. And we're not the only independent advisory. There are others too. But here's what independence means. It means that we're not captive or beholden to any single insurance company. We work with all the insurance companies, and we actually offer both types of plans. So we offer Medigap and Medicare Advantage. You'll find that many advisories actually are only appointed with a handful of carriers, if not captive to one or two, and they only sell one type of plan. For example, there are many advisors who just specialize in Medicare Advantage, for example. I think another difference between us and other advisories is the way that we use technology. You can see this through getchapter.com, our website. There, we're looking at historical premium increases, for example, to make sure that just because you're choosing a plan that's more affordable now, you won't see a big premium spike increase on the back end. And also, we're really merging technology and the human experience together. You get a short list of options through getchapter.com, and then you have the opportunity to speak with an agent, me, hi, about your options. And we can go through together and figure out which of those three that were shortlisted for you is actually the right one. And very few advisories provide you that shortlist and then give you an opportunity to actually speak with an advisor and discuss your options. All right. Thank you, Jan, for that question. Just going to take another question here before we wrap up. I see that there's a question on enrollment deadlines and when coverage will go into effect. I see, well, if right now, if you're operating under the annual enrollment period, a change you make now will actually go into force January 1. So I think we want to distinguish between changes to your plan that you're making under the annual enrollment period and people like Ronald who are aging into Medicare. So the reason Ronald's coverage, for example, started October 1st is because that's actually when Ronald turned 65. If you're older than Ronald and you already have a Medicare Advantage plan, then making a change to that plan won't affect December, it'll affect January. Your new plan will start January 1st. Another question here from John, if you have a Medigap or Medicare Advantage plan, how can you change it? What are the requirements to change it? Great question, John. And this, as you mentioned in your question, very much depends on the type of plan that you're choosing. So for a Medicare Advantage plan, there are typically 2 times that you can change it per year, generally. The first time that you can change it is during this annual enrollment period right now from October 15th to December 7th. And that's when we see a lot of clients choose to make changes to their plan. Another time that you can make changes, let's say you're not happy with a selection that you made now and you want to change your plan in February, let's say, you're allowed to do that under the Medicare Advantage open enrollment window, which runs January 1st to March 31st. There, a change that you make to your coverage won't go into effect until the first of the next month. And the rules on when you can change your Medigap Advantage, your Medigap coverage are very specific. And also there might be medical underwriting involved. So I would definitely reach out. My number is listed, or you can email if you'd prefer, so that we can discuss your situation one-on-one and I can find out what state you're in, because that's really going to determine what your options are for changing your Medigap coverage. All right, from Sandra. How should I compare whether to stay on my spouse's employer plan versus Medicare? Great question, Sandra. We deal with this question a lot because many people are on their spouse's coverage and they're at an inflection point. Do I decide to stay on my spousal coverage or do I start Medicare Part B? And I would step back and ask, first, do you enjoy your spouse's employer plan? If you do, and you're not paying that much for it, or maybe you're not paying anything at all, then you're free to stay on that plan. And you can stay on it until you're ready to start your Part B benefits. Assuming, of course, it's a large employer plan, 20 plus employees. Now, if you're actually paying I've seen premiums as high as $2,000 per month. If you're paying $2,000 per month for your spouse's coverage, then you're likely going to save hundreds, if not thousands of dollars by starting your Part B coverage and even purchasing a Medigap plus a standalone Part D plan, which is the most expensive route you could go to cover your supplemental, would be a lot more affordable than paying a high premium on your spouse's plan. From Carlos, I got a Medigap Plan F a few years ago. I've heard that this plan isn't available anymore. Why should I be concerned? Carlos, I'm so glad that you flagged this question. The Plan F, the Medigap Plan F, is no longer available as of January 1st, 2020. Now, that's for new enrollees, but because you already enrolled in Plan F, you're still allowed to make changes. Here's the thing though. Because Plan F isn't accepting new members, and they haven't been for the past year, and what we've been seeing and what you're going to see through your premiums is that the premiums are going to keep going up and up because the cohort of people who have a Medigap Plan F are just going to get older. So whereas people who are enrolling in Plan G are 65 or above, the people who are on the Plan F are people who already opted into that plan starting in January 1st, 2020 or before. So that's why premiums are going to go up faster with a Plan F than you would see by going to a Plan G. And Plan F and Plan G work pretty much the same way, except for that $198 annual deductible that you would owe with a Plan G. And if you want to talk more about your options, Carlos, feel free to reach out and we can discuss them in detail. From Ophelia, should I work with you as a national advisor or the advisor my colleague recommended? And Ophelia thinks that the advisor that her colleague recommended works in New Jersey. Okay, so great question, Ophelia. I'm in Tempe, Arizona. Other members of the team are in New York, and we do help clients nationally. We're licensed and appointed in many, many states. And some clients prefer working with a local advisor. And the reason that they prefer that is because they think that that advisor will have some specific knowledge about the area. And sometimes that's true. Other times we find, though, that the advisor is just a specialist in one type of plan within the area and actually isn't appointed with all the plans that they could possibly sell in New Jersey, for example. So whereas we at Chapter pride ourselves on advising on both Medigap and Medicare Advantage plans, and then being appointed with all the carriers in New Jersey, some local advisors in New Jersey are only appointed, sadly, with just a few carriers, and they really can't advise you on all the range of options that you could potentially see. Thank you for your question, Ophelia. From Charlie, do I need to choose a drug plan when I enroll in Medigap, or can I wait? Charlie, this is an awesome question because as I mentioned let me go back to this slide. As I mentioned under the third misconception, there are penalties for late enrollment. And here, what I want to focus your attention to is the Part D penalty. So remember earlier in the presentation, I was talking about the client in their 90s who wants to add Part D standalone drug coverage to their Medigap plan, but they have 174 months of penalties added up. If you wait past your window to have creditable drug coverage, and that window is 63 days typically, then you're going to start owing penalties after that window begins. And it's going to be 1% per month for every month that you wait. So that's why, Charlie, it really makes sense to choose a drug plan right when you decide to sign up for Medicare. And if you haven't signed up for a drug plan yet, then definitely reach out. I want to talk to you one-on-one and find out what medications you're on so we can see what drug plans are right for you. Well, I promised that I'd wrap up by 3. We're right on the dot. I really want to thank you for joining me this afternoon. I hope that you reach out. I hope that you found this helpful and that you use it to really find the Medicare coverage that is best suited to you and your loved ones, whether you're here because you're helping a family member or you're here just because you turned 65 and you want to understand what your options are. I really want you to know that we are here for you. We are here as a resource for you. And I hope that you'll continue to, I want to hear from you. So please reach out to me and please reach out to our team. Thank you. Have a great afternoon. Yeah, it was just hard.